How's everybody doing? Hopefully your day is going well. My day over here is going perfectly well, and thank you guys for being here. Thank you guys for watching. I appreciate you guys. I appreciate you all, and once again, thank you guys. My name is Jacquet, and for those of you that doesn't know who I am, and I am in the real estate, insurance, and finance industry. And thanks to you guys for subscribing to the channel. Thanks to you guys that have been supporting and helping me to help this channel to move forward. I definitely appreciate every single one of you guys. And if you have not subscribed to the channel yet, if this is your first time, definitely recommend that you subscribe to the channel so that you can continuously to get updates on what's coming out. And like I said, I am in the real estate, insurance, and finance industry, and I wanted to come out and talk to you guys a little bit about Medicare Part A for the year 2020. And I will be coming out with some more information with regards to 2021 once we are approaching that threshold. I will also be making other videos with regards to Part B, C, and D. And I will be putting my link down below. As you guys can see, this is my webpage that you guys could definitely get hold of me, get in contact with me. That's the brokerage that I affiliate with, I partner with. And if you guys ever have any questions, that's a great way to get hold of me so I can answer those questions for you outside of commenting down below. I will be putting links down there so that you guys will be able to click on the link and make it easy access for you guys. So you guys can just get hold of me real quick and simple. All right. As I said, this is my page. This is me. That's definitely my number. That's the company that I'm affiliated with. And I wanted to talk to you guys about Medicare Part A in the year 2020. So guys, I don't want to delay this any further. Why don't I get going? Medicare Part A is hospitalization or skilled nursing confinement insurance coverage, which is just as it states up here. Part A is hospital insurance for confinement in a hospital or skilled nursing facility per benefit period. So guys, meaning that, what does that mean? That means that if you wind up at the hospital, be sure that you are admitted into that hospital. So if not, you will be responsible for some cost for the bill, and Medicare will not assist you if you are not admitted or confined to that facility. So guys, I don't want to delay this any further for you guys. Why don't I get going into Medicare Part A? As I said, guys, Medicare is one of those. Well, I have not said that yet. I've said it in other videos. Medicare is very complex. It's not easy to understand, which is why it's very important to deal with a professional that understands Medicare. Which, of course, yours truly. I've been doing this for quite some time, for quite a while now, and it's something that I understand and do very well. And as I always say, I am the best of what I do. And if there's somebody that's out there that that's better than me, I just don't know that person. So it's good to work with somebody that knows what they're doing, that understands what they're doing, and that could actually recite what they're doing without any complication. Guys, why don't I get going? So Medicare itself, if you wind up in a hospital from day 1 to 60, right? That's the part where a lot of folks get confused. They have Medicare Part A and they wind up at the hospital, but they're not admitted into the hospital, and they wind up with a heavy bill, with a hefty bill. So guys, this is exactly what this is. From day 1 to 60, Medicare will cover the remaining portion as long as you meet the deductible, which is right here for the year 2020 of $1,408. That's coming straight out of your pocket that you would have to meet first, which is the Medicare deductible, before they could start paying towards anything. That's exactly what that means. All right, so guys, that means that like I said, if you are into a hospital, that you need to make sure you are admitted into that hospital and do not stay there 2 to 3 days and then thinking that all you're gonna have to pay is $1,408. No, Medicare will not cover any part of that. You will be responsible for that full bill. So guys, why don't we move into from day 60 to 90, which is about 30 days span, and see how that plays out. So of course, once you get to day 60 and 90, things do change a little bit. And as you guys will see, and right here, all eligible expenses after patients pays, which is the per day copayment. The per day copayment is $352 per day, which sums up to a 30-day time span of $10,560. That's what you would be responsible for doing that 30-day period of time. So guys, listen, don't worry about this cost. There's ways that I'm going to show you guys. I'm going to explain to you guys how you guys could help yourself from all these costs and that heavy bill. There's several ways that we'll be able to deal with that. Okay, so just don't get spooked yet. Just stay with me, and I'm going to show you guys how to actually alleviate some of these causes, and how this could help you some. Okay, so just stick with me to this. So that's what this means, guys. If you only have Medicare Part A in the year of 2020, and you wind up with at a hospital, and that's what you're looking at, you're from day 6, once you move from 1 to 60 days, and from 60 to 90, which is about a 30-day span, you would be looking at $352 per day, which comes up to the total, as I had mentioned, $10,560. So guys, why don't we look into what if now we go from day 90 to 91 to 150 days, which is about a 60-day time span. Medicare will still help. Yes, it will still help. After all eligible, of course, yes. After all eligible expenses have been made by the patient, which is the person that's on Medicare, per day, it'll be at that point now $704 per day. That's the co-payment, and that could be as much as $42,240. That would be for that 60-day period. Now, if you ask me, those are heavy costs. Let's start with this for an example. We look at from day 1 to 60. You got to come out of pocket of $1,408. And if you stay beyond 60 days to 90 days, so now you're looking at $352 per day. So within a 30-day time span, you're talking about $10,560. And if we move towards, and let's say something really goes drastically, and you have to be in there for more than 90 days. So if you stay in there from day 91 to 150 days, which is a 60-day time span. So now you're looking at $42,240. That's a lot of money. I'm sorry, that's a lot. $1,000 is a lot of money. Let alone $1,408. That's still a lot of money. So if you ask me, that's a lot of money. And if you could get somebody to help you to help you navigate the complication of Medicare, if that was me, I'd definitely take the help. Like I said, guys, if you ever have any questions, I'm here for you. I'm here to answer any questions that you may have and help you navigate through this complication of Medicare. All right. So, guys, why don't we look at if you were into, let's say, a skilled nursing facility. So, if you are into a skilled nursing facility, now at that point, from days, 50, 150. So we move to 151 days. By that time, you're in skilled nursing. Okay, you're in skilled nursing. So yes, Medicare will still, help. It'll still continuously to contribute towards that. Within 3 days after you being there. So now, after 3 days, of you being there, it'll go from that to 20 days, and of course, there's still a copay with regards to that. So from 21 to 100 days, there's a copay of $176 per day that you still have to meet as a copay, with regards to you being into that facility, into a skilled nursing. So that would come down to $14,080. That's a lot of money. So if there's ways, once again, to avoid those costs, to not having to pay for something like that, definitely, I would definitely sit down with a professional, somebody that understands this, material, so that you could get some help, so you could get this thing situated. All right, so definitely that's something that you guys could definitely, if you have questions about, definitely contact me so that I could definitely help you with regards to something like this, so that you can get the proper help that you need, so that you don't have to come out of pocket and shelling out $1,408 or $10,560, $42,240, $14,080. That's a lot of money. So now let's move to that. What if you need a hospice care? Okay, you need hospice care and all that stuff, and you need to deal with, you need to get some services. Of course, with a doctor's note, with doctor's recommendation, that Medicare will still help out with that. And of course, there's still gonna be, some kind of co-payment and co-insurance that's involved in that. It's not all for free. A lot of folks believe that, Medicare will cover everything. No, Medicare does not cover everything. Medicare is more like a 80/20 program, meaning that they'll pay for 80% and you'll pay for 20%. That's Medicare.